Leslie Rout. I'm going to perform the breast self-exam video first. I would introduce myself to the client. Hello, I am Leslie. I'm going to be your nurse today. We're going to do a breast self-exam on you. I would confirm who the patient is. Are you Mrs. Jones? She would confirm. I would verbally prepare the client for the exam. The first thing we're going to do is just touch your breast tissue just to confirm that there's no masses there. So I will try to keep you as covered up as much as possible so that we're not exposed. Once we have introduced ourselves and prep the patient, we would expose one breast at a time. You can palpate the breast tissue in all four quadrants. You can use a circular motion to determine that there are no masses on the breast tissue, the nipple or the tailspin. Cover up this breast tissue and repeat on the other side. One thing that I would do is I would have the patient roll over for the examination. A little difficult on me. And prop the pillow. When you do the breast self-exam, their arm would be up. And one thing that you want to do is look in 3 different positions to determine if there's no dimpling. You can have the patient raise their arm above their head. You can have them put their hand on their hip or down at their side. Also, you would want to make sure that the breasts are symmetrical and the same size, so you would want to look at them both at the same time, and they are symmetrical. We're going to perform the testicular self-exam on our patient. We would repeat the same steps as the breast exam. Introduce yourself to the patient, confirm their identity, and explain the procedure to them. You would provide for privacy as much as possible. And then move it down. The first thing that you are going to do would be to inspect the penis and the outer genitalia to make sure that there were no abnormalities. You're going to inspect the scrotal tissue and make sure that there are no abnormalities there, as well as look for hair distribution to make sure that everything is even and not abnormal. You would look at the penis and make sure that there was no drainage coming out at the end. You would palpate the penis to determine if there are any masses, and palpate the testicles one at a time using your thumb and one finger to determine if there are any masses. You would cover the patient back up. Next step in the video will be to teach a breast self-exam. I have 3 of my students here today that are going to learn how to do breast self-exam. When teaching a breast self-exam, we would want to always make sure you do it about the same time every month, after your monthly cycle, after your period has ended. And the reason for this being, a lot of times you have swelling and tenderness in the breast, and so you wouldn't be able to tell if that was normal or abnormal or if it was just due to your period. So we want to wait until after you do have your period for the month. The next thing you would want to keep in mind is after your period has ended, you're going to do it twice, once in the shower while you're standing up and once lying down. The method that you will use is you will go one breast at a time. You're going to palpate, which means to touch the breast tissue. You can use one hand at a time. If you're doing it on yourself, you're going to be able to do one hand. And you're going to use a circular motion, go all the way around the breast tissue to make sure you don't have any lumps. If you feel any lumps or nodules or anything, any lumps in there, and then palpate up towards the underarm area. Make sure that there are no swollen lymph nodes. You're going to do that again. You're going to do that in the shower and then lie down when you do it. When you lie down to do that portion of the exam, you can take a pillow, place it underneath your shoulder blade, like this. And you're going to raise this arm up so that it kind of extends the tissue up so that you get a better feel. Use this hand to do this breast and repeat the same thing on the other breast. Any questions? Okay, thank you. Next, we're going to demonstrate to 3 of my male students how to perform a monthly testicular exam. You're going to want to do this the same time every month, first in the shower and then lying down. So what you will do is first examine the scrotal area to make sure that there are no abnormalities or masses. You're going to palpate both testicles to make sure you don't have any masses. Palpate the penis to make sure there are no masses, no discharge, and that the hair is evenly displaced. If you didn't see any abnormalities, you want to contact your doctor as soon as possible.